Welcome back. Today our guest is Dr. Srikant Talari. He is practicing homeopathy since 15 years. Started a charitable OPD in Lonavala. A lot of research activities are there. The publication is there. The art and skill of case taking, a practical integration by Dr. Srikant Talari. Then international webinars are there. Srikant regularly conducts webinars for homeopaths in UK, Australia, Canada. Has taken online lectures for Western College Homeopathy in Canada. Regular faculty at the Other Song International Academy give regular webinars for the same for national and international practitioners. A lot of webinars in national and international level are there. Then research work, COVID research, active part in research at KEM Ruby Hall Clinic Pune. Research on role of homeopathy in COVID cases. Presently doing research on granulomatous mastitis. And the topic is BORGES approach to homeopathy. It's quite interesting. And on behalf of Ifph, welcome doctor. You can have the platform for the next 40 minutes. Dr. Srikant Talari. Yes, he's just joined. Yes. Welcome. Please proceed. Would you please adjust your camera? We can't see your. Yes, right. Good.
I was actually not able to unmute my mic, so that's why.
So when you join, you will be co-host. Now it is co-host. You can proceed.
Thank you, sir. Thank you, everyone. Welcome to today's session. On Monday also, I talked on the same topic. Some of you might have attended Monday's session. Any of you attended Monday's session? I just want to know, because then I'll have to share new cases. If not, I can share the old same cases. If you can please reply.
Dr. Talari,
yes.
In this session, the audience are different, so you cannot ask for the review for the past session in this session.
No, I'm not asking
with the new session. There are some people who are old past in this session, but here the many new participants have joined. So this is it is not the same session. Hindi and English are different sessions. So you have to start afresh with this session.
Okay, so I don't need to worry to repeat the cases.
Yeah. No, you can repeat, sir. You can no problem repeating the Hindi. Whatever you have spoken, that will be okay.
Okay. So hello everyone. My topic for today is not trip. It is so my topic for today, BORGES approach. Okay. So when we think of Boger or BORGES approach, what is important to know is that Boger was the first person who said that pathology is important in homeopathy. Because before Boger, the stalwart that we had was Dr. Kent. And Kent has made one statement where he said that, mind is more important than body, firstly. And he also said, he said, mind is more important than body. And he also said, if symptoms match the mental symptoms, then if a remedy matches the mental symptoms, then you can sort of ignore the pathology, or you can sort of ignore the physical symptoms and base your prescription on mind symptom, because mind is more deeper. Correct? Now, after this, what happens is most of us have this idea that we don't need to look at pathology. It does not matter if patient has diabetes, or if patient has hypertension, or if patient has cancer. What has to happen is there has to be only symptom similarity, and if there is symptom similarity in physical and mental symptoms, that is enough. That is how we generally felt, right? Now, what happened when Borges came? He introduced two very important concepts. As far as I have understood, these are two most important concepts of Borges. If you understand these two important concepts, you get the real essence of Borges' approach. So the two concepts are, the first concept is anamnesis, okay, and the second concept is pathological general, right? So this is most important. So what does each of it mean? So first let's take anamnesis. What does anamnesis mean? Basically, anamnesis means tracing the picture of the disease. Tracing the picture of the disease. What does tracing mean? Tracing basically means history. So Boger says that history is very important, or more, another word for it is evolution of disease is very important. Evolution of disease is very important. So what does this mean? Let me explain this with an example. Okay, I will explain it through cancer cases. Okay, I will just choose two cancer cases, and through that I will explain it. Okay, even if the audience is new, I will request, many of you are Indian, so you might be understanding Hindi, so I will request you to see the previous session to see what cases I shared last time. This time I'm sharing different cases. Okay, so okay, so case number one. Okay, case number one is of a woman who comes with brain tumor. She has cancer and she has brain tumor in her fourth ventricle. She is around 50-55 years old, and she basically comes with the following history. Okay, what I observe is, the first thing when I see the patient is that the patient is obese. Okay, patient is obese, and I actually went to visit the patient. I had to sort of house visit the patient because she was not uh, sort of um, able to come to the clinic. So I visited the patient. She was bedridden, and what I see is that she is lying down. I ask her a few questions. What is happening to you? So she tells me only one symptom. She tells me that since a long time, my right arm and my right leg has been numb and it feels heavy. So I'm not able to function properly with my right arm and right leg. And I feel a sort of numbness, tingling in that extremities on the right side. That is the only symptom I had. Recently, this increased so much that actually I have a foot drop now. So while I'm walking, I'm dragging my feet. I'm not able to even lift my right feet now. I am actually dragging my feet while walking. So my daughter got worried. She said, no, we have to go to the doctor immediately. So we went to the doctor, they investigated, and then they told us that, see, your mother has cancer in the brain, and because of that compression in certain areas, she's having these symptoms in the limbs, and it's a very advanced cancer. There is not much that we can offer. It is too deep inside to go in and do surgery. Surgery itself may be fatal. Chemotherapy also we cannot give. Radiation also, there is no use giving such radiation in the low in such deeper levels. It will damage a lot of her original things. So it's better you take her home. There's not much that we can do. So patient tells me that, as it is, I'm going to die now, doctor. There's nothing much that you can do. They have given me just 15 days. My only wish is that, my other daughter stays in US. She will sort of need at least 15 days to, set things up and come here, get tickets, etc. So my only wish is I should be alive at least by the time she reaches. I want to meet her, my grandchildren, and after that, if I die, I die. So if you can do that much, I will be very happy. So after this, the patient sort of slept. So I asked the daughter, tell me what is the history of her. So she tells me that it was around 2, 3, 4 years ago that my mother started having complaints. She started complaining of hot flushes, heat in the palms and soles, anxiety, etc. So doctor said these are menopausal symptoms and they will pass away in few months. And actually it is at that time only that my mother also complained of this right arm heaviness and right leg heaviness. So this symptom did seem strange at that time. But our doctors, they investigated. They did CT scan, they did MRI, they did everything. And then they observed that all this is normal. There's nothing they found in the brain. So they said, Are, this is nothing. This will pass away in few months. It seems to be part of the menopausal sort of history. So you don't worry. You just sort of wait and watch. As you enter menopause, all these symptoms will disappear. So we ignored. We didn't do anything for 3, 4 years. She kept complaining, I have heaviness, I have heaviness. We said, okay, mother, we have done everything, we have checked everything, everything is normal. But now recently she started to drag the feet. She had foot drop. So we said, we should go to the doctor. We investigated and this is what has come up. They are saying it's a very advanced cancer. So this is the history. So I asked, okay, what is the sort of talk about her nature? So she says her nature is that she's a very anxious person. She wants the house very neat and clean, and things have to be in their proper place. So she's very cleanliness freak, very fastidious, that kind of a woman. Secondly, she's very worried about family, relatives, how they are doing. Are they doing okay? If anybody gets ill, she'll be very worried. She'll call them, are you okay? How are you doing? So she's pretty much worried about family, relatives, and others, things like that. Okay. Now, what is important here is, initially, I used to sort of think, as I started the lecture, that you just have to take symptom similarity. Don't worry about pathology. No, whether it is brain tumor or whatever it is, you don't have to worry. You only have to take symptoms. So what symptoms I took? I took symptoms like, first symptom I took was obesity. Patient is obese. Then I took complaints began during menopause or during climacteric. Ailments from trifles. She's very neat, clean, fastidious about household things. So obese lady who is very, very conscious about cleanliness at house. Based on this, I gave her the remedy graphitis. I felt it is a good remedy. I gave her graphitis and also this weakness, etc. So we say, no, what pulsatilla is for puberty, graphitis is for menopause. So based on that, an obese woman, very fastidious, clean, it seemed a good drug picture. Yes or no? Everybody, can you please reply? Am I clear till now? Hello, hello, hello. Please reply. Yes. Thank you. So then I thought graphitis is good remedy. So I give graphitis. And then after 1 week, this happens. Daughter calls me. She says, my mother is even more worse. Huh? She has lost her appetite. Last time you came, she was at least talking for 5-10 minutes. Now she's not waking up at all. She's not eating any food. She's not talking with anyone. She's always almost like unconscious state. With great difficulty, we have to wake her up. Hmm? So it seems that she will pass away pretty soon now. So basically, patient was worse. So now what to do? I felt graphitis was a good remedy. It covered all the symptoms. Okay. That is when I thought maybe I should be thinking about pathology. I am been ignoring pathology. So I asked the patient that what is no, I didn't ask the patient. So I started looking for brain tumor remedies. I said, no, I have to treat the pathology. First, pathology I have to treat, only then patient will feel better. Only then the constitutional remedy will act. That kind of thinking I started to get. So I thought, no, forget about all this. First, let me find a remedy which suits her brain tumor. So I started reading about brain tumors from Google, from clinical books. I started reading. So as I kept reading, I understood that, this sort of tumor, basically what happens in this tumor is that in brain tumors, there is inflammatory exudate. There is inflammations created, and because of that, there is swelling that is formed. And as the swelling increases, there is space occupying lesion, and this space occupying lesion will press on those surrounding areas, and those areas will have symptoms. So this gave me little bit hope. You know why? Because one of the idea that I was having is maybe this is too advanced a case and there is actually brain tissue that has grown. Whatever remedy I give, it's not going to reduce the brain tumor in 1 day. Will it? If it's actual growth. But then when I came to know that it is actually an inflammatory swelling, then it gave me hope. Inflammatory swelling can reduce fast. Yes or no? So that's why I had hope that no, even though this looks an advanced case, because it's an inflammatory thing, inflammatory swellings can reduce quickly. So that gave me hope. This is not a solid tumor. This is an inflammatory swelling. So swelling can reduce. That gave me hope that I still have scope in this case. So then I started searching what are the common brain tumor remedies in our materia medica. I searched repertory and then there was not much that I found in the repertory. Okay. So then in the repertory, I didn't find. So what I did, I put search words in the repertory and I said, show me all materia medica symptoms which have the word brain tumor in it. Okay. So I searched it. Okay. So long story short, I searched and then you can see here, it shows 13,265 symptoms came up. These are all the symptoms from all materia medicas which have the word brain tumor in them. Okay, all remedies, all materia medica. So if you click on first symptom, here it will show what is the remedy. Second symptom, it will show what is the remedy. Third symptom, it will show what's the remedy. So here at present, it is on the first symptom. Okay. Now I said this was very long back when I just started practice. So I said as it is, I have less patience. So I have a lot of time. So even if it is 13,000 symptom, let's sit and read. Maybe I will get something. So to my luck, what happens is the first symptom in itself, I get it. So you read this congestion to single parts, eyes, nose, chest, abdomen, ovaries, arms, legs, or any organ of the body, marking the onset of tumors or malignant growths, especially at climacteric. This is exactly what happened in this case. That patient developed or started developing the cancer during climacteric. Yes or no? And what is interesting, what is the remedy here? Sulfur. Okay. Then you read the second symptom. Second symptom is also from the same remedy, that is sulfur. And both symptoms are actually given in Allen's keynotes. To facilitate or absorption of serous or inflammatory exudates in brain. Fantastic, no? Exactly what is happening in the pathology and exactly what is matching the history of the case. Are you getting this, everybody? The history tells me that the cancer began during climacteric. The history matches, the pathology matches. Yes or no? So I give sulfur, patient improves drastically. She gets up, she's like nothing has happened. She starts eating, she starts walking. Everybody's surprised. What happened to mother? She's walking as if there is no cancer. Everything is fine. She's eating normally, she's passing stools normally, she's walking about, everything normal. Her daughter comes from US. She comes with the plan that now I will go back after mother's funeral. But you know, mother lives for 1 month. She says, okay, another 15 months days mother will live. She lives for another 15 days. Then she thinks, okay, now mother will die, I will extend for another 15 days. But mother does not die. So she says, okay, I will only go now. So she goes back. After she goes back, after another 2 months, mother actually dies. So she lived for a very, very long time than what was expected. Most importantly, she lived a very, very healthy and pain-free and like a normal person till the last day after sulfur. Okay. Now, what is important? The important aspect here is the learning. That what this case taught to me is pathology is important. This idea, this myth that I had, that, you know, I have to give a remedy which matches the symptoms. I don't care about the pathology. This idea broke. This idea broke down when I saw this case. Because before this case, I was always only looking for what is the constitutional remedy of the patient. Find the constitutional remedy, patient will get better. This was my approach. But after this case, my approach changed. My approach changed and I first started looking at or studying the pathology. Okay, so then what started crossing my mind is, then is the whole concept of constitutional remedy wrong? You know, maybe we should not practice like that. Why am I wasting my time looking at mental symptoms and all this? Does the remedy fit mental symptoms in any way? So I started studying sulfur to see if sulfur matched the mental symptoms also. Yes, are you all there with me? So then, to my surprise, I found out that sulfur actually matched the mental symptoms also. You know, you see anxious disposition, she is apprehensive for others, anxious for others, much concerned about my state of health and feared least I might get really ill. Okay, apprehensive about future, what will happen in the future, what is going to happen to my relatives, what is going to happen to me, very anxious. Most importantly, what I thought is, this cannot be sulfur because patient was fastidious. No, and we know sulfur is what? Dirty. No, sulfur is dirty, sulfur is not fastidious, etc. To my surprise, what I did is I searched for, where is that rubric? To my surprise, I found this rubric in Complete Repertory 2018. If you see, mind, fastidious work-in, there are only 3 remedies in it, and one of the remedies is sulfur. So then I understood, this remedy also matches the mental emotional state. So from then I understood that something Boger is telling that we are not understanding. What is Boger telling? That is when my mind started to get intrigued into Boger. What is Boger's approach? What is Boger saying? What is Boger saying? Now, what is Boger saying is this, that firstly, he's saying, take the history. Take the history. What does history means? How did the complaints begin? Like in this case, how did the complaints began? Complaints began because there was or during climacteric ailments during climacteric. This is a very important symptom. Boger will tell you always look for the origin. Where is the origin? How did the actual symptom begin and why and when did it begin? What is the origin of the complaint? That you have to look. Anamnesis basically is telling you look for the origin of the complaint. So in this case, the origin is climacteric. But you be specific. Don't just look for only climacteric remedies, but look climacteric remedies with malignancy. If you combine this, then you will get it. Are you all with me? Yeah, please reply. You can reply on the chat. Yes or no? No reply. I can't see. Okay, I will continue. If you can please reply, I will at least know. Okay, so anamnesis means what? You have to trace the history. History is very important. Okay, so for example, one more case that I can tell you is of a man who developed colon cancer. Okay, and his main presenting symptom was constipation. Okay, when I asked him about his constipation, he tells me that his constipation began around 20 years ago. So I said, how did it begin 20 years ago? So he says that I had constipation, just like that for no reason. And he actually was working in the army. He was a physiotherapist in the army. Okay. So while he was working as a physiotherapist in the army, he had to undergo what regular checkup every year. They have to undergo checkups, investigations, etc. So they investigated for his constipation. At that time, what they found out is that he had polyps. Polyps in the colon. So they suggested that we'll take out your polyps, your constipation will get better. He said, no, they are not inflamed, they are not bothering me in any way. This constipation is minor thing. Forget it. Don't do anything. I don't want to take any allopathic treatment, or I don't want to undergo surgery. So he ignored it. So for 15-20 years, he had constipation, and then he developed cancer. One day he developed cancer because he had low hemoglobin, etc. And what happened is, after he was diagnosed of cancer, they gave him antibiotics. They said, you take antibiotics, firstly, whatever infection is there, that will get cleared off, and then we will start some chemotherapy, etc. Now, what happens is, after antibiotics, his complaints become even more worse. He started feeling very weak. He started suffering a lot. Before that, he was only having constipation. So he said, I don't want to take any treatment. I don't want to take chemotherapy. I don't want to take radiation. I will only take some alternative methods of treatment. So I will choose homeopathy, but I will not take any chemotherapy, radiation. Forget this. Okay. So this is when I was called in. Now, first thing what I look at this case, is the history. In the history, what you see is patient has constipation. But what is the cause of constipation? Yes, the cause seems to be what? Polyps. Yes or no, everybody? Hello, hello, hello. The cause seems to be
Yes.
constipation, right?
Yes, sir.
Sorry, the cause seems to be polyps, because of polyps. So polyp basically is what is like a psychotic growth, correct? Is a psychotic miasm. No, not psychotic, but our psychotic miasm in homeopathy. And now that psychotic miasm was there for many years, and now it has converted into a syphilitic pathology like cancer. Correct? Are you all with me?
Yes, sir. Yes, sir. All others are muted. That's why nobody is responding, sir.
Okay, thank you. So you can reply on the chat, others, even though, okay. So then what I understand is, because in the history, what you see is that there was a psychotic background behind the constipation, and now it has become syphilitic. Mainly the pace of the disease, the development of the disease was first based on psychosis and now has become syphilitic. So the first thing I know is that it has to be a psychotic miasm remedy. Okay. Then what I did is I looked at the rubrics. Ailments or aggravation from antibiotics. Okay. Aggravation from antibiotics. Okay. So when you look at this rubric, no, from synthesis repertory, I am looking for which remedy out of this is especially belonging to psychotic miasm. So you can see here medorinum, right? And then I ask him, how is your constipation? Then he tells me, I strain so much that I have to bend backwards to pass stool. Then if you open medorinum from Allen's keynote, you see medorinum has this. Can only pass stool by leaning very far back. If you lean backward, then you are able to pass stools. This is a keynote symptom of medorinum. So based on this, the patient got medorinum and patient did very well, etc., etc. Now, I don't want to actually show the case result, etc. But what I want to tell you is, in this case, it is psychotic miasm. Now, the same thing, if you remember the sulfur case, you know what we saw? That patient had complained 4 years back. Yes or no? 4 years back, she started having menopausal complaint. At that time, patient was investigated. But did anything come out? Nothing came out. Actually, they did a CT scan, MRI also. Nothing came out. There was no trace of cancer. So basically, even though the cancer symptoms had began, there was no pathological basis for it. There were basically functional symptoms. Are you with me? There was initial symptoms, but without any pathology developing anywhere. So that's why in that case, the miasm was what? Sora. That's why the remedy that she required was sulfur. But in this case, you see, the miasm is psychotic, because in the history, you see, there was a psychotic pathology which has now got converted into syphilis. In the first sulfur case, there was functional pathology which suddenly has now got shifted into a syphilitic pathology. So the fundamental pathology that is there are, and how it develops into the present pathology. This evolution of disease you have to see. How is the disease evolving? That is what is anamnesis. What is the evolution of the disease? What was the first symptoms? What were the pathologies at that time? What are the initial symptoms? What are the characteristics of the initial symptoms? That you have to look. What is the origin of the complaint? ये सब शुरू कहाँ से हुआ? क्यों हुआ? उस समय patient, how did all this begin? Why did it begin? What were the pathologies at that time? That you have to look. And then you have to see how slowly new pathologies came and how the patient is in the present pathology now. this evolution of the whole disease. Disease in homeopathy does not mean only diagnostic disease. Disease means all the different diagnoses. First I had polyp, now I have cancer, now I have AIDS. So all this is part of the disease evolution. What you have to do is you have to take each of them, describe symptoms of polyp, describe symptoms of cancer, describe symptoms of AIDS, and see what is the overall evolution. How is this disease evolving? What is the pace of the disease? What is the underlying pathogenesis? This you have to understand. That is what is BORGES approach. Now I will share you one more case to tell you what is this pathological general. Firstly, you have to look at history. If you look at history, you will get an idea that what is the pace of the disease, how is the disease evolving, etc. Okay. The second most important thing is pathological general. Okay. So I will share another case for that. Okay. So for example, so, for example, this was a case of a female who was around 60 years old. Okay. When she came for the first time, no, her main complaint was pain in knee joints. Okay. She had pain in knee joints. How much time do I have? I have 20 minutes. Good.
Yes, you can go up to 8:45, then have a discussion for 15 minutes, sir.
Acha. So
Yes.
I have 7-8 minutes to finish this case.
Yeah, of course.
Yeah. So the patient initially came to me for knee joint pains. Okay. She said, I cannot walk. If I walk, and especially if I sort of am getting downstairs, then I have lot of pain. This pain in knee joints aggravated by descending stairs. It is a characteristic of a particular diagnosis. Anybody knows what it is? It is a symptom of osteoarthritis. Okay. If you have pain in knees, especially aggravated on descending stairs, or if patient says, when I am descending stairs, I feel like I will lose, or my joint is slipping away, or it will fall down. I cannot get downstairs. Very typical diagnostic symptom of osteoarthritis. Okay. And osteoarthritis basically means degeneration, old age degeneration of the knee joint. So she came to me for this, but she also had heart complaints. She had high blood pressure. She said that I have had myocardial infarction 1 or 2 times, and then I somehow got through it, etc., etc. So I don't remember what symptoms I took, but I basically something like graphitis I gave. I took 1 or 2 mental symptoms, some physical constitution, some physical general, some local symptoms. Khichdi I gave some remedy. I think most probably the first remedy I gave her was sulfur, some mental symptom I must have said. So what happened? Patient did not do well on sulfur. Okay, she sort of started developing cough, and her knee joint pain was same. Instead, she started developing new symptoms. She started developing cough. It was very dry cough. She felt there is fullness in chest, etc. And then by that time, I should have known that patient already has heart complaint. So maybe this cough is related to heart. But I sort of, it didn't click me. So what happens is I give some more remedy, not thinking that the cough is from heart. I give some other remedy. She does not improve with the cough. And after around 5 days, she has a myocardial infarction, another myocardial infarction. So after 10 days, patient is gone. I don't hear anything. Suddenly after 10-15 days, they call me. They say, what doctor, she had another myocardial infarction. This is second or third myocardial infarction. We are not understanding what to do. So then I understood, that cough must have been because of heart. I should look for a heart remedy with cough. So I asked her symptom, how is the cough, etc. So she said, my cough is with dryness, etc., etc. So this is what is BORGES approach. You have to understand the underlying pathology which is causing the symptom. So the underlying pathology is what? Heart. So a remedy which has heart's action and causes cough. The characteristics of cough was it was dry cough, cough with pain, etc. And then I asked her about myocardial infarction. How was it? When did it happen? She said I had myocardial infarction at around 2 or 3 a.m. in the morning. I woke up with cough, 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 and then I said chest pain, breathlessness, and I started sweating. So family knew. She started having profuse sweating and breathlessness, means she's myocardial infarction. They rushed me to the hospital. So this is very important symptom of actually spongia. If you have a case where the cough is because of heart condition, and if there is dryness, and most importantly myocardial infarction around 2, 3 or 4 a.m. in the morning, this is very characteristic timing of spongia tosta. Spongia tosta myocardial infarctions appear around that time, 2, 3, 4 a.m. So 2, 3, 4 a.m. Myocardial infarction, dryness, dry cough along with heart complaints. Based on this, I gave her spongia. They said, "Arey, doctor, what nice remedy." Her cough completely disappeared. We had admitted her. We did so much. But first time remedy worked for her. Spongia tosta I gave. First time remedy worked for her. But then the cough disappeared and she started having heart complaints. She started having what? Atrial fibrillations. Okay. Heart would palpate, then it would stop. Then family said, "Arey, what is happening, doctor? Cough is to gone. Now she's breathless. She's having hypertension, very high hypertension, 200 by 100. We are getting scared. I think we will again start allopathy, etc." I said, no, wait. So they waited with me for 15, 20 days, but they saw that the blood pressure was not coming under control. I thought spongia will work, but it did not work. So they went to a cardiologist. So the patient walked in, and while walking the patient started having palpitation. Then the cardiologist immediately said, this is very typical atrial fibrillations, so you take XYZ remedy, her atrial fibrillations will stop and her blood pressure will come under control. So they gave some XYZ remedy, I don't remember the name, and atrial fibrillation stopped. But remember one thing, whenever a patient is given a remedy to stop the symptoms in the heart, like atrial fibrillation, what will happen is 99% of cases in the next 3 or 6 months will develop stroke. They will develop stroke, they will have paralysis. Guarantee. You should tell every patient, you took this remedy, no, your heart will feel normal. But I guarantee you, in the next 3 months, 6 months, or maximum 1 year, you will have a stroke. You will have a paralytic attack. So if you want to take medicine, you take. But this is going to happen now. Okay, and this happened. After exactly 3 months, this patient had stroke. They called me, "Arey, doctor, Abhi, now this patient has stroke. What to do?" So I said, no, you get her admitted, we will see. So after discharge, you meet me. So around 20 days, 25 days passed, and patient is still in the hospital. Why are you still in the hospital? Then they say that her hemoglobin is dropping day by day, and what is happening is that her oxygen level is dropping. Now this is much before COVID was not there at that time. Okay, so if you remove the mask, immediately her oxygen would drop. So how can we remove the mask, doctor? If we remove the mask, she will collapse, she will die in the next 5 minutes only. So we are not able to take discharge, we are not able to get out of the hospital, and our bill is increasing. They are saying there is not much we can do over here. You can take the patient home, but we are not able to take the patient home. So please, doctor, please come and see and what you can do. So I went to the hospital, I checked, I asked the intern, please come. Generally, they are homeopaths, at least in Maharashtra. I don't know in other states. So I asked, I expected it will be some homeopathic student. I called him. I said, what happened? What are they saying? What is the cause of the stroke? So he said that They say that it is because of cerebral artery stenosis. I said, what is cerebral artery stenosis? So I opened Google and again I searched, what is cerebral artery stenosis? Then there I read that cerebral artery stenosis basically means atherosclerosis of the arteries, of the cerebral artery. I read atherosclerosis of cerebral artery and suddenly it clicked to my mind. Actually, no, the first day the patient came to me, the main complaint she had was knee joint pain. That is still as it is. It has not improved. And it was a case of what? Osteoarthritis. What is osteoarthritis? Degeneration, old age degeneration of knee joint. What is atherosclerosis? Degeneration of arteries. Suddenly it clicked my mind. Actually, in this case, the main pathogenesis, underlying pathogenesis is degeneration. So I thought I need a remedy which basically addresses degeneration. Are you all with me? Yes?
Yes, sir. Yes, sir.
So degeneration. So then I searched in the repertory, show me the rubric, what are the remedies in fat degeneration. So I found one rubric and it had only two remedies, phosphorus and vanadium. So then if you open vanadium, this is what Boric writes. This is a remedy indicated when heart's action is weak, when there is fatty degeneration of liver, heart, and arterial walls. Its action is as oxygen carrier. No, this patient oxygen was the problem. Increases the amount of hemoglobin. Her hemoglobin was dropping. So suddenly all symptoms also match. Underlying pathogenesis match. I gave vanadium. Patient's oxygen went off. She could sort of get discharged from the hospital and she came back home. Okay, so this is what is Boger's pathological general. When you look at different pathologies, different pathological diagnosis, patient has heart disease. In heart disease, basically what is happening is her heart is degenerating. Patient has stroke because her heart and arteries are degenerating. Patient has knee joint pain. Why? Because there is degeneration in the knee joint. So even though there are three different pathologies, there is one underlying pathogenesis which connects all these three pathologies. That is what is pathological general. This general pattern which connects these three different location of symptoms, that is what is pathological general. That is what is genius. This is what Boger calls is the genius of the remedy or genius in the patient. You have to understand the genius. You have to first understand what is the general pathological pattern from either the history or studying the pathologies and looking at the underlying pattern. Easier way is look at the history. Difficult ways have very good clinical knowledge and elicit the pathological general. Like this, if you learn, you will understand Boger's pathological approach, right? So I hope I have sort of given you some clarity on what Boger's approach is. I end my talk with this cases and I request all of you to ask me any questions if you have.
Yes, indeed, a very interesting session. Definitely, it also indicates that the effort a physician should take in order to reach a remedy, not a medicine. It's time for discussion. Those who would like to participate, please raise your hand. It's a wonderful session. A lot of brain work is there. Reflection is done. As a result, we got better results. That's the most important thing. Then an important fact is that we must judge how much time we should wait. That is an important session, important time. Unfortunately, if you wait for longer time, the patient will perish. At the same time, if you are hasty, definitely then again the case will fail. So the doctor's dilemma starts there.
Yes.
Dr. Ram Shah, sir, what is your opinion? He's a regular participant with a firm and strong voice. Sir, please.
Really, everyone, and congratulations, Dr. S. Talari ji. Very, very thanks. Very nice presentation. Good lectures. Beautiful deals. Boger approach in homeopathy. Miasmatic cause, main cause, fundamental law of homeopathic, main cause of disease miasmatic, sora, psychotic and syphilitic. Without sora, no disease, no symptom. Any man suffering from soric in nature. Soric combination, without combination, soric combination, no disease. So, very nice builds the miasmatic remedy, sulfur, medorinum. According to homeopathic science, sulfur, king of soric remedy,
Yes.
and medorinum, king of antipsychotic remedy. Very nice. Thank you. Very, very thank you.
Yes, thank you, sir. Now, Dr. Hariharan, sir. Sir, please unmute, sir. Hariharan, sir.
Sir,
Yes,
okay, sir, your lecturing is very nice, very good, case taking, and everything is correct. But one of my doubt is that, not doubt, by approach, is that, see, after taking the case, a physician must think by his common sense which approach should take. Sometimes it may Kendian, sometimes it may Burger or some other ways. Sorry, certain cases your approach is very, very correct. But in certain cases, we must approach the Kendian approach. What is your opinion regarding that?
yes, please.
Sir, my opinion is that I agree with you that every case needs a different approach. Correct? But when we are teaching and when we are advocating a particular system, no, what I feel is what Boger has said actually, that when we are trying to prescribe based on mental symptoms, giving more importance to mental symptoms, there are greater chances that we will go wrong. But if we first base our prescription on pathology and then look for mind symptoms, our chances of success are higher. And this is what I have learned from my practice, that I am still a very, very staunch believer that mental symptoms are very important and mental symptoms should be considered in every case and they should be given a lot of importance. But this approach of first see, it is like building the building from the foundation to the upper floor. For in my understanding, the foundation is the pathology. The first floor is the symptoms. The second floor is the keynotes. And the third floor is the mind symptoms. If we are, first going to go for the mind symptoms, it's directly on the top. The foundation is not strong. The building can fall anytime. But if we first build on pathology and then also look at the mind symptom, the building has very strong foundations and fundamentals. The chances of success is always more in this approach. This is what I found in my practice.
Okay, sir. Sometimes the mind may be the reason for causing this pathology. If it's so, how the approach must be?
Yes, sometimes there is no pathology. The pathology itself seems to be originating from the mind. That time also, what I found out is one very important tip that I can give all of you is that we have to look for the cause and the effect, and we should prescribe on the effect and not the cause. This is what I actually taught in my last session when I came last, I think I came in December, that we have to look for effect. Generally, what is happening is, for example, if a patient says that I have blunt trauma, and because of that trauma, I have pain, immediately we think of arnica. Yes or no? But what we have to see is we have to look for the effect. What happened because of this trauma? Did the patient develop bluish black discoloration? Then it is arnica. If the patient developed redness, it is bryonia. If the patient developed sprain, it is different remedy. Similarly, in mind, what we have to do is, if a patient is telling that I have sort of complaints after I lost a relative, sudden death of a relative, then we think that immediately what we should take is ailments from grief. Yes or no? But the problem is, we should not take ailments from grief. We should take, because of this incident that this relative died, what is the effect on you? What happened to you because of this? And I have found out, sir, that very, very strange answers come up. People say, one case I remember, she said that I developed ailments after my grandfather expired. So I said, what was the effect of this? It was very saddening. Okay, that is emotion. What was the effect on you? So she said, my grandfather, he was very, very strong person. I said, what do you mean by strong person? So she says, we used to work in the farm, and he was very, very sort of innovative. He used to tell me that this is how you have to do farming, and he used to create new instruments. He used to create new techniques by which our farming can improve, by which we can have more yield, by which we have to work less, etc. And now when I have to do farming on my own, I feel, array, grandfather is not there. I don't have that innovative skills. I don't have that creative skills like my grandfather has. So now how will I do? So this feeling that I don't have innovative skills, I need innovative skills. This is what the remedy has to have. That is what we have to always look for. What is the effect? What did the grandfather mean to this patient? That meaning has to be covered in the remedy, not just that the grandfather died and patient developed grief. If we are only going to prescribe on grief, then we will not move beyond ignitia, nitramur, acid phos. We will only give those 3-4 remedies, and we will have very less results. But if you look at the meaning behind what did this death do to her and what it meant to her, what this grandfather meant to her, you will have real characteristic symptoms. And if you prescribe on those symptoms, you get unbelievable results. Sir, I gave this patient strontium carb, 1 dose. She had allergies for 5 years. Since then, it's now 1.5 years. She has not had allergies. No allergies. And only 1 dose, 2 dose, enough.
Okay, so we have to finish in time. It's the precision homeopathy. We all know that it's a precision medicine. So the program of homeopathy should also be a precise one. So it's time to conclude. So as altogether a nice presentation. A lot of topics were discussed. You know that the role of Boger, his synopticy, the moon's time and moon phase of remedies. Then the Boger body has a repertory, a lot of intellectual work is there. A commendable job is done by Dr. Srikant Talari. On behalf of IFPH, I am expressing sincere thanks to Doctor. You please continue to attend our program as well as you must present regular topics. Have that bright future. Let us hope so. With the remark, let me conclude today's English edition. Hope you that we will meet again tomorrow. Till then, goodbye. And what Dr. Shaila for the continuation program in Malayalam.
Okay.